Next, we'll hear from Jerry Vogel with a presentation from 21st Century Dentistry. Now, he'll have also a second presentation, and it'll be on the newest offerings from Panthera Dental. Jerry.
Good morning. Hope everyone's doing well after a rough St. Patty's Day. Sounds familiar. So, I'm here today to talk about a company, Panthera. My name is Jerry Vogel, as I had mentioned, and I am the Executive Vice President of Panthera Dental for the U.S. Panthera Dental is a technology company that provides solutions unlike anything in the industry. This here is our backdrop of our manufacturing facility with a bar that we took out of a solid piece of titanium. And we have the ability to treat any patient. If you leave with nothing else, just know that there's no patient. We're working with the VAs. We can do ears, we can do noses, we can do deformations from oncology or trauma that previously we never would have thought could have been treated. So that's what makes Panthera Dental. So we're compatible with all the implants. We can take any design, as I mentioned, 25-year warranty on all of our products. And on any implant that is used, we will guarantee their implant as well on our system. Again, I mentioned we do oromaxillofacial prosthesis, and there's no fee associated with this. So, I mean, other than the product. So what happens is we use a device called a 3D viewer. And this is 21st Century Dentistry. You don't have to go buy a $40,000 scanner and worry about replacing spindles, this, that, and everything else. We actually send you an email after we scan it in our office with this, and this is an interactive tool where you can measure and get all of the information you want on that case through a web-based 3D viewer. Okay? Just a picture of some of our bars, full arch or partials. However many retention pieces they want. But what's happening in the 21st century? You know, there are other issues now. I mean, people have been wearing bars long enough that you need to be thinking about what's the next step. So hygiene is really important. It's ironic, you know, we're talking hygiene because 90% of the patients who are getting these treatments are probably because they didn't do hygiene in the first place. But maybe after they spend a good amount of money, they'll be a little bit more concerned. And who are we giving them to? We're giving them to the aged patients. So there's a dexterity problem, whether it's arthritis, whether it's shaking, or they have caregivers taking care of them. We have new products that can address this. And what about the old ones? How do we replace the old ones? What if my bar isn't working or is broken? What do I do? Panthera has the answer. And we have that with two new products, which I'll get into right now. So the first one is a friction fit device, a lot different than the one other that is out there right now because we use nylon bushings. So when we put it on, it snaps on, and I'll invite you to our booth that's 1055 to try and pull it off. And you'll say, wow, it doesn't really, it seems like it's fixed, but it's not. It's just an excellent retention, and the nylon bushings could be replaced if in fact you need it. Also, I talked about retrofitting existing bars. So you have a failed implant or the bar has broken, whatever, what do? Well, with our system, we have the 10 top implant companies. We have the ability to go right to the implant level and get a good passive fit for and a new bar for your patient. Lock and release. So I mentioned the dexterity challenges. So patients who are conscious and want to do better hygiene, they often can't get their bars out. Or if it's a traditional bar, similar to the ones that we make, it's very difficult for them to do effective hygiene. So in this case, we have two buttons that are on the side, on the mandible, that you actually just push the buttons and the denture will pop out. And so they can do the hygiene. If you look at the base there, you can see that, you know, that looks very, very easy to do proper hygiene on a daily basis. Additionally, there's a cost benefit to this as well, because if you look at the abutments there on the anterior section, you'll see the width of them. It actually has opened up the opportunity for us to get involved in 3 implant cases that are fully secured. You know, people have said we originally had 2, then it had to be 4. Well, if money is an issue, perhaps 3 can do it with the lock and release. Okay, the double structure. This again goes into a situation where you can't get a solution, a restorative solution onto bad implant placements or awkward implant placements due to the oncological or trauma cases. So what they do is they put a secondary structure over that. It's milled at only 0.8 of a millimeter, so you're not losing vertical challenges with that. At a 25-degree angle, so you're getting proper hygiene for the patient in both titanium and zirconia. And by the way, our zirconia bars, when we sinter our zirconia products, we have the ability to screw in attachments into it. Nobody else can do that. Everybody else has to glue it in. So that if something goes wrong with the attachment and you need a new one, you simply screw that one in. We're the only company doing that. And then we're using PEEK. We're the only ones doing that for a double structure as well. And PEEK is a much softer, compliant material, a much more natural feel to bite and all of that for it. Very, very good. Been used in the medical industry for 25 years. We can do copy waxes if you prefer to wax them up. So Panthera Dental, we consider ourselves on the bars. I think we've established ourselves as being one step ahead. Unfortunately, we only get everyone's problem cases, but you know, we can do easy cases too. So we're not one step ahead. We think we're 2 steps ahead. And we believe that because the hottest thing right now in the United States, forget about in dentistry, is sleep. And especially today after St. Patty's Day with some of you. Not me. But sleep is huge. 50 to 90 million patients a year. And you as hygienists and staff, you have the ability to identify these patients with a simple, adding to their annual chart a few simple questions. Do you have headaches? Do you have acid reflux in the morning? Are you tired in the afternoon? Do you fall asleep while driving? As a passenger, hopefully. You know, these things are all indications of sleep apnea. And or snoring. I mean, it could be as simple as snoring. And you know, there's the classic men are in denial and women speaking code. So if you ask a guy, does he snore? No, I don't snore. I'm fine. And you ask his wife, she'll tell you different. You ask a woman if she snores or if she has sleeping problems, and she'll say no, but I do wake up. I have a headache. I have acid reflux. All of those are indications of sleep apnea problems. So we have the most lightweight device that's on the market right now. I'd invite you to come to our booth at 1055 to take a look at it. It's made of a surgical nylon. It comes with an unconditional 5-year warranty. It has a flange on the side. Now, I'm an apneic, and I've been wearing a device for over 10 years. And I had metal rods in my mouth, and I also have a slight cant with my teeth. So other devices had me locked in all night, straight back. And in the morning, I would have a lot of discomfort in my TMJ area, so I had to get a bite adjustment. With this, because of the design and the flexibility of the surgical nylon, it's like a sling. So I protrude, I enter, and then it's like a sling. So I wake up in the morning and feel refreshed and ready to go. So I encourage you all to stop by the booth. I encourage you all to consider getting into the sleep arena. Like I said, there are 50 to 90 million patients who are begging for your help, and they don't know it. They wouldn't think to go to the dentist because I didn't. When I had my CPAP, I was all through the medical industry, and I wasn't in the dental industry at the time, and there was no answer for me. But you have the answer. You have the solution to both snoring and sleep apnea, and I encourage you all to discuss that with your patients. So thank you all very much. Have a wonderful day, and appreciate your time. And Winston, thanks for all your help, and Stephanie as well. Doc?